Hello, my name is Associate Professor Geoffrey Painter and I'm an ophthalmologist, which is an eye specialist looking after the health of one's eyes. We're here today to talk about macular degeneration. Macular degeneration is a disease that affects mostly the elderly people in our society, and we have one of the highest rates of macular degeneration in the world because of our elderly population, and it's one of the leading causes of blindness in our society. It's unknown what the cause is. We believe there is genetic elements to it, but we're still, after many years of research, unable to find what the real cause is. It's a slowly progressive disease in most cases, but can be quickly progressive if it becomes a wet form. We have treatment for that, but we have no treatment for the slowly progressive dry form. And this is where I'm talking to you today about macular degeneration, because we've got an opportunity partnering with the Sydney Adventist Hospital and Australian National University to do groundbreaking research on macular degeneration, where it is felt that if we can find a link between a particular protein in the body, which is linked in the genetic code of the body, and link it to various levels of macular degeneration, we may be able to find a marker for the disease and be able to follow disease progression, and possibly even maybe able to find one of the possible causes of macular degeneration. And of course, in many diseases, when one finds the cause, we can hopefully find the cure. So this research is very important. It's being held at a group practice called Gordon Eye Surgery, of which I'm one of the principals of. And we're very proud to be associated with the SAN and with the Australian National University. And any help that you can give us to help this important research is greatly appreciated, and I think will be very beneficial to not only everybody's help in this generation, but also to future generations, because we need to find a cure for this disease, because it causes significant burden of life, and it can cause a significant burden on one's enjoyment of life, causing reduction in ability to read and ability to drive, and causes a very profound loss of enjoyment of life, and can lead to even loss of independence and inability to be able to do one's financial affairs. All these things are very distressing to people as they get older, and the loss of all these particular very important activities is a great burden on one's, and if we can find a cure to prevent this disease occurring in the future, it would be a wonderful achievement. Thank you.
And I was just going to add a little bit, because medical research can sound a bit boring when you're trying to give money to something. But I think just an example of that is that glaucoma, which you may well know somebody who has it, used to be the leading cause of blindness in middle-aged to elderly people. And it's now much less common, purely because of research that's gone into the disease, the mechanisms and the treatment. So early detection, early treatment, better treatments, managing what the mechanisms are and then targeting treatment has made a dramatic improvement in the diagnosis and management of glaucoma. So now we need to turn our attention to macular degeneration and see if we can do the same thing for that disease to help our population. Thank you.